Asbestos. A health hazard. The impact of asbestos exposure on human health has been studied for many years. Results show that inhalation of asbestos fibers is the leading cause of many serious diseases. Detailed analysis of asbestos-related illnesses has revealed that most of these are dose-response related. The general assumption is that, the greater the exposure to airborne asbestos fibers, the greater the risk of developing an illness. It is important to remember that intact, undisturbed asbestos-containing material, ACM, generally does not pose a health risk when maintained in good condition, and not disturbed, as they are unlikely to release asbestos fibers. However, asbestos fibers may be released due to vibrations or air movement, deterioration over time, or damage stemming from maintenance, repair, cleaning, or accidental contact by workers or building occupants. Once inhaled, these fibers can remain in the lungs for a long period of time as they are not easily destroyed or degraded, leading to several disabling and fatal diseases, including asbestosis, pleural plaques, lung cancer, and mesothelioma. These diseases do not develop immediately following exposure to asbestos fibers and have a long latency period, taking some 20 years or more from initial exposure until the onset of symptoms. Asbestosis. Asbestosis is a disease characterized by lung scarring which reduces lung elasticity. People with asbestosis usually exhibit shortness of breath accompanied by a cough. The scar-like tissue does not expand and contract like the normal lung tissue and breathing becomes difficult. Blood flow to the lungs may also decrease which causes the heart to enlarge. This is a serious disease which can eventually lead to disability or death. Pleural plaques. Pleural plaques are characterized by areas of hyalinized collagen fibers that form in the pleura, the thin membrane that surrounds the lungs and envelops the inside of the chest. The majority of people with pleural plaques do not show any obvious symptoms which may take many years to appear. Mesothelioma. Mesothelioma is a rare, aggressive form of cancer that develops in the linings of the lung, heart, abdomen, or testes. Despite other potential risk factors, the only known cause of malignant mesothelioma is exposure to asbestos. It has a long latency period and its symptoms may take some 10–50 years to appear. Mesothelioma is almost always fatal, with an average life expectancy of 12–21 months. Lung cancer. Asbestos-related lung cancer is a malignancy of the lungs that develops when a person inhales microscopic asbestos fibers which then become lodged in the lung tissue. Over the course of many years, the accumulation of these fibers in the lungs leads to considerable genetic and cellular damage causing the lung cells to turn cancerous. Prognosis for this disease depends on the type and stage of cancer.